three elders representing the diverse Indigenous communities here in Ottawa. They will be sharing their prayers as we begin our meeting. I would like to remind everyone not to take any photographs or video during any part of the opening prayers. Now please join me in welcoming First Nations Elder Eileen Compton, Inuk Elder Sally Webster, and Métis Senator Parm Bergie. I could ask you to come forward. Kuyanamik, Marcy, thank you. Two regrets this evening. Three regrets. Member Kavanagh, Vice Chair, and Madame Patel, correct. Confirmation of the minutes of April 15th, 2019. Thank you. And do we have any declarations of interest? Okay, seeing none, thank you. We have 43 communication items that have been received and held on file with the Board Secretary. Item number 1, we have a motion first to introduce reports.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Protecting Our Community's Health, Ottawa Public Health 2019 to 2022 Strategy, Ottawa Public Health Reconciliation Plan Update, Ottawa Public Health Submission to Health Canada on Reducing Youth Access and Appeal of Vaping Products, Potential Regulatory Measures, Review and Update of Board of Health Policies and Bylaws, 2019 Operating Budget Q1, Board of Health for the City of Ottawa Health Unit Status Report, and Performance Appraisal of Medical Officer of Health, in-camera, personal matters about an identifiable individual, reporting out date, not to be reported out, be received and considered.
Carried. Thank you. The first item is my verbal report, which we'll hold. The second is Dr. Etch's verbal report, which we'll also hold. Thirdly is Protecting Our Community's Health, Ottawa Public Health 2019-2022 Strategy. And that's that the board approve Ottawa Public Health Strategic Plan for 2019-2022 as outlined in Document 1. And we have a presentation, we'll hold that as well. Number 4 is the Ottawa Public Health Reconciliation Plan Update. And we also have a presentation for that. Number 5 is the Ottawa Public Health Submission to Health Canada on Reducing Youth Access and Appeal of Vaping Products, Potential Regulatory Measures. And it's that the Board of Health for the City of Ottawa Health Unit receive the Medical Officer's Health Submission to Health Canada on potential regulatory measures to reduce youth access and appeal of vaping products as outlined in Document 1 and approve the recommendations contained therein. Now, we don't have a presentation for that one, so we can carry that unless there's any questions or comments. Okay, if it's quick.
Thank you, Mr. Chair. And my question to the so we talk about vaping product, but we don't talk about e-cigarette. Is there a different, like I know I met with staff and they briefed me on it, but I don't recall, what is the difference between both? How's that?
I think that e-cigarettes is one way to refer to a device that can be used for vaping. I think vaping is a broader term that means to heat something to create a vapor.
Okay.
So they're both included in this consultation and recommendations to the government.
Is it fair to say the e-cigarette is hard to addict in the public? Like if somebody using it, it doesn't leave a smoke behind like the vaping. Am I correct on this?
The e-cigarettes do create a vapor. It's not smoke so much as the vapor. That's why we make the distinction.
Okay, and in this report, it'll talk about both, right? Okay, all right, thank you, Mr. Chair.
Okay, can we receive and approve then?
Yes, receive.
Okay, thank you. Number 6 is a review and update of the Board of Health policies and bylaws. There's no presentation for this. It's that the Board of Health for the City of Ottawa Health Unit 1 approve updates to the Board of Health procedure bylaw as highlighted in this report and detailed in document 1. 2, approve updates to the Board of Health delegation of authority bylaw as highlighted in this report and detailed in document 2. 3, direct staff to bring forward a report in Q3 of 2019 with recommendations for enhancing the Board of Health Code of Conduct, including options with respect to enforcement of same as outlined in this report. And 4, direct staff to bring forward a report in Q3 of 2019 with recommendations for a Board of Health travel policy. Can we carry that? Okay, thank you. Number 7 is the 2019 operating budget Q1 Board of Health for the City of Ottawa Health Unit status report. And it's that the Board of Health for the City of Ottawa Health Unit received the 2019 Q1 operating budget status report for information. The accountant has a question.
I apologize for this. Maybe Mr. Flabaria can help me. In documents, in the package we received, and I'm just looking at document 07A, and just to understand it, operating results summary March 31st, 2019. And there's the annual expenditures and the year-to-date budget and the year-to-date actual. And spent percentage, oh, I got it now. The spent percentage, for example, 93% is the spent percentage of the year-to-date budget and what we spent in the quarter and not the annual. Very well. That was my question.
So you
I
answered your own
apologize for
question.
being
You sure you're not a lawyer? Receive then? Okay, we have potentially one in-camera item. It's the performance appraisal of the medical officer of health in camera. Do we need to go in camera or can we simply receive? Carry, rather. Carried? Okay, thank you very much. So I will go on to my verbal report then. So I'd like to update everybody on some new developments and highlight OPH events that have taken place since we last met, as well as some upcoming summer events, because it finally seems like summer may actually have arrived. So keep our fingers crossed about that. To begin with, some news from the province. Most of you will have heard by now that as a result of our strong advocacy for public health and the advocacy of others around the province, on May 27th, Premier Doug Ford and Steve Clark, Minister of Municipal Affairs and Housing, announced a reversal on their plans for retroactive cuts to public health in Ontario. I've continued to work closely with the Mayor's office to ensure that the province remains informed on our position and to plan forward. It's important to note, however, this reversal in retroactive cuts does not necessarily mean that the province is changing its mind on modernization and on cuts that could potentially come into effect in 2020. It does demonstrate, however, their willingness to be flexible and to listen to the concerns of the municipalities and to the residents of Ontario. The province is planning consultations over the summer months. These consultations will inform legislation expected to be introduced in the fall. Ottawa Public Health will work to ensure that the City of Ottawa and Ottawa Public Health have a strong voice in those discussions. The province's proposed changes have provided an opportunity for us to speak about public health in a way that we really have shied away from in the past. And to better articulate that, when public health is doing its job well, it's almost invisible by keeping people healthy and out of the healthcare system. Public health is foundational to the health and wellness of our city, and we are incredibly proud of Ottawa Public Health's work. We've seen a lot of that over the last few months, unfortunately, because of tornadoes and floods, measles outbreaks. We've seen it all come to the forefront and be handled in a very compassionate and professional way. The city will continue to fight to maintain public health's important mandate. Now I'd like to talk a little bit about the CTS funding update. So moving on the heels of a disappointing decision from the Ministry of Health and Long-Term Care with respect to operating funds consumption treatment sites. That's not a problem. With respect to operating funding for OPH's consumption and treatment services at 179 Clarence, I'm grateful to our federal partners, in particular to Minister of Health Petipa Taylor and her team for stepping in to provide temporary funding to help keep our CTS open until the end of the year. This funding, which was announced last week, enables the team to continue to meet the needs of current clients, gives OPH, more importantly, time to consider how to best transition clients to other services if funding is no longer available come 2020. Locally, on April the 24th, City Council officially declared a climate state of emergency for the purpose of naming, framing, and deepening the city's commitment to protecting our community from climate change. A sponsors group mandated to provide guidance on the review and update of the Air Quality and Climate Change Management Plan and the Energy Evolution Final Report will include representation from multiple standing committees of council as well, and I want to thank Member Menard for this because we had discussions about it, as well as a member from the Board of Health, and the member who will be going forward on behalf of the board is Member Kavanaugh. In approving Councillor Menard's report on this matter, Council also directed City staff to embed climate change considerations across all elements of City business, to complete a vulnerability assessment, and to develop a climate resiliency strategy to reduce the impacts of a changing climate. This is aligned with our Board of Health's work on mitigating and adapting to climate change. A quick update on Lyme disease. Speaking of climate and the long-awaited beautiful weather, we are well aware of the health benefits of being active outdoors. It is important, however, to enjoy better weather while simultaneously reducing health risks. With the arrival of warmer weather, ticks and mosquitoes are not far behind. Mosquitoes and ticks can cause serious illness. Tick bites may transmit bacteria that can cause Lyme disease, and later in the season, mosquito bites may transmit the West Nile virus. In a new effort to raise awareness among residents to protect themselves from the bite, Ottawa Public Health organized a bug spray blitz, an insect repellent discount week, to promote the use of insect repellent as one of the many preventative measures. As part of this campaign, from May 8th to the 20th, local business partners gave customers a discount on insect repellent products containing DEET or Icaridin. Participating businesses in OPH promoted the campaign, which was a big success, with more than 54,000 people reached through Facebook. OPH continues to raise awareness of these prevention measures through social media and information packages distributed through councillors' offices. In addition, as part of OPH's commitment to reconciliation, staff is working with Indigenous partners to make mosquito and tick health protection information available in a culturally appropriate manner. Next, I would like to highlight OPH's participation in the 2019 Helmet Safety Event. The Helmet Discount Weekend, held on May 4th and 5th, involved 25 retailers with 28 stores in total, providing a 10 to 20% discount on helmets. OPH staff participated in various helmet safety events to demonstrate proper helmet fit, including at Cyclo-Fusion, Mayfair Bike Parade, Pedal Play Mobile Bike Rodeo, and Sunday Bike Days event. Additional events are upcoming, including Vanier Velofest and the Bayshore Bike and Community Fair. OPH's helmet safety promotion campaign was well received in social media and included a CTV News interview. Comparing the 2019 campaign to the previous year, there was an increase of 28.19% in the number of users viewing OPH's website. The Facebook, Instagram campaigns saw an increase of 42.5% in reach and 57% in impressions. Finally, some of you may have seen a new Party Safe video on social media. As part of OPH's Party Safe program, staff were working with local influencers to make social media videos to promote OPH messaging on fentanyl, naloxone, and general party safety tips. Great to see the Ottawa Red Blacks, Fury FC, Ottawa Champions, and local musician Michael LaBelle participating. Mike Wood with Ottawa Special Events has been an instrumental partner connecting OPH with these influencers, and OPH is collaborating with him on an upcoming event to train youth and young adults to use naloxone. A big thank you to Mike and Ottawa Special Events because they have a huge social media reach, and this is something they felt very strongly about, reached out to us, and I want to also commend public health staff on jumping on this right away so that we would have something in place for the beginning of festival season. It was a very short timeline, but they did a fabulous job, and the videos are going to be up and running very soon, and the event is going to be held very soon as well. Moving on to our exciting summer events, OPH has been participating in a variety of community events across the city, including Fury School Game Day, Sunday Bike Days, and many community-led family events. Messaging related to ticks and Lyme, helmet safety, and immunization continue to be the most popular topics. Planning for larger summer events continues. OPH is looking forward to the Cheo's Teddy Bear Picnic, the Mayor's Canada Senior Tea, and working with many festivals and events to provide training and party smart messaging over the summer. Soon you will hear about this year's Capitol Pride Parade. We hope you will be able to participate with us in the Capitol Pride Parade on August the 25th. Finally, as you know, the Association of Local Public Health Agencies, ALPHA, held its annual general meeting and conferences last week. I was fortunate to be able to attend along with members Cloutier and El Chantiri, as well as Dr. Etches. I'd like to take this opportunity to thank members Cloutier and El Chantiri and Dr. Etches for their participation. Also like to invite member Cloutier to provide a brief verbal report on the event.
Thank you, Chair. Merci, Monsieur le Président, and thank you to my colleagues on the Board of Health for allowing me the privilege of going. As Chair Eglai said, it was the annual general meeting, and it was the first time, as was stated at the conference, that all 35 Board of Health units across the province were present. And of course, it's not a big leap to figure out when there's a crisis, as we have seen with the budget announcements in early April by the provincial government. We need to come together to find solutions and to discuss them and to try to find solutions going ahead, given the reality that we're faced. You apologize, Chair Eglai, you said when public health works well, it's almost invisible. And that's very true. And there was a session, the cyclical nature of investments in public health during the conference, when there are items, I guess, like Walkerton or like SARS, investments are forthcoming because the value of public health is self-evident. The value of public health is always evident to we who work in it and to those who in the department who are so committed and work hard day in and day out. It is that always continuing effort and energy and the strategies, implementing the strategies that make it work. So just a summary of it, as Chair Eglai talked about, there was, it certainly was an agenda that was in flux. Originally the focus was going to be on mental health, but it quickly changed to dealing with the cuts that were proposed by the provincial government. And we talked about ticks and Lyme disease and those other very important issues, and we learned about them. And so we heard that the government is going ahead with their new model, but there was some discussion about that. But we also heard and delivered the message that the government can't move ahead without ALPHA, the Association of Local Public Health Authorities, and our individual Board of Health's participation, because we're the ones who deliver the services to the residents and that are needed for our residents. And you know, municipalities, it was said at the conference, pay about $2.1 billion of health care costs, and we do that through public health, through long-term care, through paramedicine, and others. And so it's important that we continue to drive that message. Again, as Chair Eglai said, there's been a bit of a moving target since April 11th with the budget that was announced and cost-sharing changes that were announced, and then the May 27th comeback or return or reset in terms of the retroactivity of some of the cuts. but there is still, we still need to work together with our other colleagues in other boards of health to make sure that that pause that was announced on May 27th is enacted. And so the fact is that the provincial government is one of austerity and savings, and I talked a little bit about the cyclical nature of investments and public health, and we all value public health, and that message was certainly delivered clearly on to representatives of the government, Dr. Williams on June 9th, 10th, and 11th. And so while the changes show that the government is listening to a certain degree, there's still changes to be done, and we have shared concerns with our other colleagues in the province, and we need to stay positive, and the leadership that we've and the networking, the conversations, Dr. Etches and Chair Eglai and certainly Member El Shantiri and I, but to a lesser extent that we had with our colleagues across the province, so that we can come to a model that delivers the outstanding services that our residents require. And so, again, it certainly was a privilege to attend and to participate and to learn in Kingston on last June 9th, 10th, and 11th. Thank you.
Thank you very much, Member Cloutier. That concludes my verbal report. I welcome any questions people may have.
One of the area we heard loud and clear, the government is maybe looking for either a win or revisiting the item, to say the least. So I think we can have our work cut out for us during the summer to work with other local MPPs in our community and present them. It's not, we didn't see a united front in all. I mean, everyone valued the public health, but it doesn't seem to me some would like to work with the government and solutions. Seems some they just want to point the finger at the province, and I don't think that's a healthy relation. So we need to do our own homework with our own local MPPs and cabinet ministers and see how can we work together in this. We made it clear, I think, during the conference, bigger is not better and it's not cost-saving. We learned that within the amalgamation of the city of Ottawa. We didn't see the saving, the promise once is going to be available for us. So I think if we continue on a messaging, yes, we want to work with all levels of government, specifically this government, and try to find a way where we can work together versus just try to create that separation at this point. That's my...
Thank you for that comment, and I can assure the board that those discussions have already started. I've had some discussions with our local MPPs. You know, the mayor's office has reached out as well, and Dr. Etches and her senior team are having some of those discussions and also having significant discussions with the senior bureaucrats in the ministry about how we go forward in making the case for Ottawa. Are there any other questions or comments? Okay, thank you. Received. I'm going to ask Dr. Etches to make her presentation then.
Thank you. Good evening. Kwe, Enge, Tanshe, bonsoir. I would also like to acknowledge the Algonquin unceded territory that we are meeting on and note it's a gathering place. This land has been a gathering place for a long time. You mentioned this week includes the National Indigenous Day, it's summer solstice as well. And, you know, it's a time of celebration of Indigenous culture. It's a time of resilience. And we recognize that it is also a time where people still experience discrimination. And people, you know, have told their stories and highlighted this in the recent report from the inquiry into missing and murdered Indigenous women and girls. And so I recommend that reading to you as well. Dans ma rapport verbal de ce soir, je me concentrerai sur la modernisation du secteur de santé publique et je soulignerai certains travaux de santé publique Ottawa au cours des derniers mois. So since the last board meeting, we have learned some additional details about the province's plans for public health modernization, and there remain a great deal still unknown. And so as the chair mentioned, the province has adjusted their plans for making funding changes in 2019, and they have also released their initial proposals for the boundaries, the regional boundaries for 10 public health entities. And we know that the consultations planned will happen with the public health field in July, and that will inform legislation that will be in the fall that will establish these public health entities for April 1st, 2020, and that would be a regional board that would be established through legislation. So there are confidential technical tables that have also been established, or will be, one with the Chief Medical Officer of Health and the Association of Local Public Health Agencies Board Executive, also with the Association of Municipalities of Ontario and the City of Toronto. So the approach I am taking, and thank you for your input, is to use multiple channels to proactively put forward solutions-based ideas of how we can have a strong public health system in the province and in Eastern Ontario. Investing in public health will help the government address their challenges they're seeing with ending hallway medicine, and it is a smart investment, so we're making that case, as well as acknowledging the need to do our part to find ways to modernize our practice. So employees are concerned about the lack of details around modernization. So the approach I'm doing is to continue to carry out my commitment to provide the whole Ottawa Public Health team with information as it comes via weekly emails and other ways of communicating messages. One thing we did last month was hold a virtual town hall. So I spoke to a camera and took questions by email for employees across our city. And we also have an internal engagement initiative launched where we're going to be, and we are already getting great ideas back, gathering information and thoughts from employees about how we have a strong public health, modern public health approach in a regional structure. During this time, I have maintained dialogue with the Chief Medical Officer of Health, David Williams, as well as with people in the Ministry of Health and Long-Term Care. I wrote to the province to explain, in particular, the value of Ottawa Public Health's integration with the city, that back office support, rent, and IT systems that the City of Ottawa provides. And this past week, I also attended the Association of Local Public Health Agency Conference, as you heard. I found there that municipally elected officials really were interested in continuing, not necessarily to fight, but to press for continued dialogue with the province about the cost-sharing change and the cost-sharing formula that puts more pressure on the cities to fund public health. And so I think that work will continue. As well, the Council of Medical Officers of Health struck a working group, and I'm contributing to that, and it would be putting forward ideas, more professional ideas about how we carry out the functions of public health. And I know that the perspectives of other public health professionals and nurses we heard about and celebrated with Nursing Week recently, epidemiologists, inspectors, communicators, all the other professional voices in public health will also help make sure we have a system that works. I've continued to meet with counterparts across the province and also in Eastern Ontario. And I have to recognize, and you may have seen, discussions are ongoing about whether the 10 proposed entities and the boundaries make sense. And in Eastern Ontario in particular, there have been other proposals. For instance, the Kingston Board heard about a proposal where Kingston, Frontenac, Lennox, and Addington would join Hastings, Prince Edward, Leeds, Grenville, and Lanark District, and Eastern Ontario health units as a separate region. So the consultation process and the technical tables, I think, are the places where these different ideas will be considered. Over the past month, we continue to look for every opportunity to showcase Ottawa Public Health's incredible programs and services, so you've heard about them. And we did have 5 MPPs, members of provincial parliament, participate in tours of Ottawa Public Health facilities. So we had them see what happens in our vaccine distribution center, our vaccine clinics, our sexual health and dental clinics. And I can tell you they all learned something, I'm sure, and took away more of an appreciation of our work. And tours were also held with board members, so thank you to those who were able to join and took that time to participate. As you read the correspondence coming from other boards of health about this public health modernization, I think you'll notice there is a common theme that comes through, and a common theme that local connections matter. Our connections to schools, our connections to social services, to police services, not just healthcare. And so that is one of the arguments and the focuses that we're continuing to put forward for any new regional model. And the importance of local collaborations across different sectors in public health was highlighted recently in a journal, the Canadian Journal of Public Health, in a study that included population health researchers at the University of Ottawa, the Ottawa Hospital Research Institute, and it was informed by Ottawa Public Health and the city's transportation department. So it demonstrated that if the city of Ottawa were to reach its transportation master plan targets for increasing the number of people walking, cycling, and taking public transit to work, over 1,000 cases of diabetes could be prevented just due to that increased physical activity. So that would reduce demands on the healthcare system and associated treatment. So I want to recognize Dr. Trevor Arneson, who carried out some of that work, who's now one of our Associate Medical Officers of Health. And before we leave the topic of our changing health system, I want to provide that update. I'd mentioned the Ontario Health Teams last meeting and our partnership with groups putting in applications. So Ottawa Public Health partnered in the application for 3 Ontario Health Teams. I'll just name them. One is called the Ottawa Health Team. That was put together with leadership from 6 Ottawa area community health centers. A second is called To Be Named by Kids, Ontario Health Team, and that was led by CHIO. And the third is the Ottawa East Ontario Health Team, and that was led by the Montfort Hospital. So that first phase of the application was a self-assessment, and those went in by May 15th. We were expecting to hear back by June 3rd, but the Ministry of Health and Long-Term Care received over 150 applications where they thought they would have maybe 20 or fewer. And so that we now expect will be notified in early July if we are to go forward to the next step of submitting a full application, which would be due in September. So there's not yet details on what that full application will involve, but je continuerai de tenir le conseil de santé au courant de la modernisation du secteur de santé publique et aussi du progrès des équipes de la santé de l'Ontario. So you'll recall at the last meeting, the board also approved a report on dental health services for low-income seniors, and that included that we would request funding if the opportunity arose. Well, on June 7th, we were pleased to receive funding without having to apply from the Ministry of Health to support a new dental program for low-income seniors. The Ministry of Health and Long-Term Care's funding letter indicated that they will provide up to $2,768,000 as base funding for the 2019 to 2020 funding year. And so that, is an initiative where we do not yet have all the details of exactly how the low-income dental program for seniors will operate. But I can tell you with that announcement, we're already planning to extend hours at our Merivale clinic, and we're looking at how we might also create another dental health clinic to be able to meet the demand and increase our service capacity. So we do thank the Ontario Minister of Health and Long-Term Care and our team for this program, which we do think will make a significant contribution to improving the quality of life for seniors in Ottawa. And I want to thank, as the chair did, the Canada, the Federal Minister of Health, Petipa Taylor, and her team for their commitment to harm reduction and the temporary funding of about $600,000 that will allow us to continue our consumption and treatment service this year. We certainly wanted to make sure that our clients, our existing clients, are supported through any transition that may be needed, and so we have kept that going, and this funding will offset that cost. Nous continuerons de travailler avec nos partenaires du secteur des soins de santé pour continuer à améliorer l'accès aux services de réduction des méfaits à l'avenir. So I'm going to turn then to mention there are two reports going to the Community and Protective Services Committee, which is a City of Ottawa committee, and they're going later this week, June 20th. Which we've contributed to these two reports. The first is on the Harmonization of Smoke-Free Bylaws report, which is going to propose to harmonize the existing smoking prohibitions and bylaws in order to consistently prohibit smoking and vaping of tobacco, cannabis, and any substance in all areas where currently smoking tobacco and using water pipes are prohibited. So the goal of this harmonization exercise is to continue the City of Ottawa's long-standing work around smoke-free objectives, and that aligns with Ottawa Public Health's objectives around let's clear the air. We want to reduce initiation of smoking and vaping. We want to decrease exposure to secondhand smoke, and we want to make sure that people who are seeking support are able to reduce their use or quit. The second report is the Ottawa Music Strategy Implementation Update Report, and that highlights the strategic partnership developed by Recreation, Culture, and Facility Services with Ottawa Public Health and the Ottawa Festival Network to expand the impact of our Party Safe program and to expand the Party Safe Toolkit, which will ensure more consistency in safe space training, in more health promotion and communications provided to festivals, event organizers, and festival goers. And June is Employee Recognition Month, so I would be remiss not to sincerely thank our staff for their tremendous and unrelenting efforts related to responding to the flood and to maintaining the continuity of operations when so many people were out volunteering to assist people with the flood. And j'aimerais profiter de l'occasion aussi pour remercier les membres de notre conseil de santé ainsi que du conseil municipal pour leur leadership et leur engagement envers les résidents lors de la récente intervention d'urgence en cas d'inondation. It's really been a whole city effort to support people. Thank you, particularly Councillor Elchinchiri. Building on our experience from the 2017 floods, Ottawa Public Health worked with the Office of Emergency Management on their Spring Freshet Task Force to prevent, mitigate, and then manage the risks of the flooding. This declaration of a state of emergency on April 25th feels like a long time ago, and it was only declared over today. And so our city has been working hard, and our team, we have a departmental command center that gets set up where we coordinate planning, logistics, safety, communications, and all the operations that our public health team carries out. We had nursing and inspector staff who were constantly present at the reception centers, and they provided information on well water, safety, testing, mental health, environmental hazards, and other health-related concerns. And public health led the Human Needs Task Force for the city. It was established by the Emergency Operations Center and coordinated door-to-door wellness visits. This work reinforced the city's ongoing commitment to addressing the needs of more vulnerable people in our community and those who might have had additional challenges due to the floods. So this work built on our strong partnership with city departments as well as the Canadian Red Cross and the Salvation Army. So that's to say that was a huge response. Thank you to everyone. And it wasn't the only enhanced response we had over that period. There were multiple enhanced responses for 2 different measles cases, for hepatitis A, and there was a tornado. So I think it's clear that we collaborate internally, externally, and we demonstrate that this emergency preparedness and response is a core mandate for Ottawa Public Health. Couple more things, it's longer than usual. I want to share really good news that Ottawa Public Health moved forward as the first city department to use the Guarding Minds at Work survey. This is an evidence-based survey. It's developed by the Centre for Applied Research in Mental Health and Addiction as a gold standard for assessing and promoting psychological health and safety in the workplace. So it looks at 13 different psychological factors that impact employees' psychological responses to work and work conditions. They look at things like workload management, at clear leadership and expectations, at opportunities for growth and development. And so this survey, you'll hear about it just a little bit later also in our strategy, it allows us to identify areas that might need action. And really, I think sometimes in times of stress and change, it feels like it's harder, but that's why I'm really pleased. We had a high response rate of 60%, and overall at this time, Ottawa scored very well on all 13 factors. That is, they had a rating of either minimal concern or that the factor was a relative strength compared to a benchmark of 5,000 other surveys administered as a comparator. So there were no factors classified as areas of significant or serious concern. And we will use this to identify things that we want to work on and then give us some baseline information into the future. So looking ahead, Ottawa Public Health is committed to engaging residents on the design, creation, and implementation of our programs and services. Again, something you'll see in our strategy. So we have new tools to do that, and so I'm happy to announce that as of today, we launched our first project to engage Ottawa, or on the Engage Ottawa platform. I think you have a little card that explains a bit more about it to have your say. The first program we're going to use to try this platform is to look at getting input from parents and caregivers to develop a new peer parenting support program. So this engagement project will be open for 8 weeks, and we'll use online storytelling and brainstorming to invite residents into a dialogue about what they would like to see in such a program. So I encourage you also to visit the website, join the discussion, share it with your networks, and we'll have the most relevant services and the greatest impact if they are what the population is going to use. So finally, on Tuesday, May 28th, Ottawa Public Health held its annual all-staff meeting, and it was an employee recognition event. And so I want to thank the Chair Eglai for being there and speaking, as well as Mayor Watson. And the words you shared, the leadership was evident, and it's very appreciated. Also, Councillor Kavanagh was there, Member Pinel, and Member Tilley. And people really do notice that, and they appreciate your presence and value your support. So thank you, and that concludes my verbal update.
Thank you very much. We'll have an opportunity for board members to ask questions, but first we have a registered delegation. Jamie Dunn, Executive Director, Civic Institute of Professional Personnel. Welcome, Jamie. I think you know the rules.
Good afternoon. Thank you very much for giving me the opportunity to be here today and speak to you. As Councillor Eglai mentioned, my name is Jamie Dunn. I'm the Executive Director of the Civic Institute of Professional Personnel, which is the union representing over 400 staff at Ottawa Public Health. And we're the biggest union in Ottawa Public Health, covering about 80% of the staff there. And I wanted to speak to you today about the province's proposed funding cuts and restructuring of public health units across the province and the danger that poses. The province proposal is really not modernization. It's a cost-cutting exercise and endangers the delivery of current programs and the implementation of programs that Ottawa needs. Regional planning and service arrangements can be accomplished, can accomplish everything that these proposed mergers are trying to accomplish, but avoid the chaos and the service interruptions that the mergers will necessitate. Separating Ottawa Public Health from the city and merging it with other public health units won't save money. We already know that approximately $8 million in in-kind services will be lost and have to be funded from the new agency's budget. I also want to confront the notion of frontline versus back-of-office work. First, because frontline is a military term and we are not at war with the people we serve. Secondly, because it's just another way to devalue important work. Try to think of delivering public health services without research, programming, evaluation, leadership, and administrative support. Cutting positions threatens programs and services. It's that simple. Speaking from a labor relations perspective, this uncertainty surrounding this proposal threatens staff retention. Staff are worried about which union will succeed and which terms and conditions of work will prevail in a merged public health agency. In addition, there will be disruptions from a representation vote and the negotiation of a new collective agreement. Merged pay between rural and urban staff will mean either cost increases if rural staff are brought up to urban staff pay rates, or retention problems if urban pay rates go down to rural levels. Finally, our 65-year history representing employees at the city means we have the relationships to solve problems without resorting to expensive litigation. Very simply put, disrupting these relationships will cost a lot of money. This is why, especially in the Ottawa context, the proposed mergers will cost money, hurt efficiency, and disrupt services. The best way to build healthy communities and control healthcare costs is by investing in public service and public health programs. A study from the United Kingdom released this month links public health cuts to 130,000 preventable deaths in that country since 2012. In our position paper, we point out that every public health dollar spent is equal to $14 in acute care costs. To put that into perspective, the proposed reduction of $200 million to public health in Ontario is potentially $2.8 billion in new acute care costs. That doesn't sound like modernization. We should be talking about is where we need to spend new money to address serious issues in our community. Here's an example of some. Immunization. Recent measles outbreaks show that public health agencies must aggressively take on the misinformation of anti-vaccination movements to protect our communities. Climate change, as mentioned by the chair, new infectious diseases and increased infection rates, extreme weather like floods and tornadoes, extreme temperatures, and poor air quality are some of the known impacts on public health resulting from climate change to which public health units are going to have to respond. And finally, community violence and violence against women. In recent years, residents of Ottawa have become more concerned about violent crime in our communities. And violence against women is an epidemic across Canada that is repeated in generation after generation. We know that public health can play an effective role in addressing both community violence and violence against women. In Glasgow, Scotland, programs involving public health, the police, and social services transformed a city once known as the murder capital of Europe. A study in the June 2019, that's this month, issue of the Canadian Journal of Ophthalmology showed that in 80% of emergency admissions for eye injuries resulting from intimate partner violence, the victim lost their eye. Think about the suffering, healthcare costs, and social costs of that violence. Community and school-based programs addressing violence in relationships are among the most effective methods of ending the cycle of intimate partner violence. These are just a few examples of areas where the province should be investing in public health, not retreating. Regional planning and service sharing can be accomplished without the cost and disruption of large-scale restructuring and mergers, particularly in the case of Ottawa Public Health. For the sake of our community, we hope you join us in insisting that Ottawa Public Health be left out of this restructuring and that the province increase investment in public health. Thank you for the opportunity to speak, and I'd be happy to answer any of your questions.
Thanks, Jamie. I have a couple of, first a request and then a question. You referred to a study out of England, and you also held up I think you called it a briefing note or a briefing paper. I'm wondering if you could send links to both of those that they could be shared with all the board members.
Certainly.
The second is, and I know that there's no certainty in these things, it's not an exact science, but Can you give us a sense from your perspective in your role that if the proposed reorganization, which would see Ottawa as part of a public health unit that ran all the way from Kingston to the Quebec border, how long you might guess or estimate sorting out new bargaining unit, new collective agreements, all those might take?
Well, I was involved in a similar situation when the federal nurses who provided care in remote and Indigenous communities in British Columbia were transferred to the British Columbia First Nations Health Authority. We were at the Labour Board for a year and a half, and then another year and a half negotiating the first collective agreement. As a result of the uncertainty of that transfer, only about half the nurses moved to the new organization, which left them in a very costly situation of arranging nurses from agencies at a very high price. That was fairly simple compared to what we're looking at. We've done some mapping, and the mapping of positions across unions and across bargaining units is very complicated in that large area identified by the province. And at least one of the unions involved has said they don't think the current transition legislation would apply anyway. So you're looking at the situation I described in British Columbia multiplied by a large factor of complexity.
Just for clarity, the situation you described in British Columbia, how many bargaining units were you dealing with there?
Ultimately, 2.
So
it was ourselves. I worked for PIPS at the time, which is the federal counterpart of CIPP. It's the professional union in the federal government, and then PSAC, which is the all employees union. And we worked very collaboratively. In fact, when we bargained, we had a 3-sided table, the 2 unions, the employer, and on the employer side was an elder to kind of keep us on our best behavior. And it still took over a year to get that first collective agreement.
And in your mapping, preliminary mapping you've done now, how many bargaining units would have to be worked with in order to make this transition?
Well, if you went with the same model that exists at a lot of public health units now, you'd have a professional unit and an all-employees unit, but there are at least 3 unions involved in arguing about the all-employees unit, and at least 4 involved in arguing about the professional, who would represent the professionals.
So you need a bigger table.
Trying to sort something out, probably all at the Labour Board.
Okay, thank you very much. Are there any other questions for Mr. Dunn? Yes, Member Menard.
Thanks very much, Mr. Chair. I think the argument you're making in front of us, just like the chair has been making, and our medical officer of health have been making, is the right one, that the cost to amalgamate is going to be greater than the expectation is, and that it's not worth it to do that in our case, in Ottawa's case. And so I like the Ottawa-centric argument that you're making. Are you planning on being there in July when consultations are ongoing? Have you presented to MPPs in Toronto? What advocacy has your organization undertaken to this point, and what are you planning on doing in the future?
Well, so far we've developed a position statement that outlines in more detail and identifies the research we relied on to take our position. We intend on speaking to councillors, MPPs, and launching a campaign amongst our members in the community to get this message across to the provincial government. And we anticipate taking part in the consultations, okay, if they'll have us. Okay.
Yeah, I think it's powerful if that is combined with what's been done by the leadership of this group already, in conjunction with what we're seeing. And obviously the sooner the better, right? Because the concern from your side, you said 450 employees that you represent?
About 400, yes.
Okay. Yeah, just because obviously if the proposal goes forward and we're combined with Kingston, there likely potentially could be reductions associated with that. And so have you done any analysis of what that would look like, the effects of those cuts to your employee group? Have you looked at that at all, or where?
Well, we don't know, and it's because it's so integrated with the City of Ottawa, we're actually getting a lot of calls from employees who work for other departments but who support public health. So if 100% of their job is supporting public health in IT, for instance, but they work in the IT department, they work in the department with IT, then they're worried if their work disappears because Ottawa Public Health leaves the city, does that mean their job's gone too? So we actually don't know the full ramifications of every single impact because there's so much, well, it's actually why it works so well. There's so much integration with the city. We were listening to one of our members talk about working on climate change. Her job is half and half. She works with policy people from the city and working on climate change issues with Ottawa Public Health. There's so much integration, which is the right thing to do. The focus should be the community, not a large bureaucratic structure or the Ministry of Health. And so far, that's what Ottawa's accomplished, and it would be a travesty to dismantle that.
Okay, thanks, Chair.
Member Tilley. Your hand up. Anybody else with questions? Member Cloutier.
Merci, Monsieur le Président. And yes, just to pick up on what Member Menard said, I think the estimate, it's in the millions of dollars, the services that the city provides to Ottawa Public Health. Des services de traduction, des services d'informatique, des services d'administration du personnel et tout, de la paye. Et donc, ce serait très, très difficile. Donc, je vais simplement me faire l'écho de votre présentation, M. Dunn, et du fait qu'il n'y a pas beaucoup d'économies à faire dans une fusion comme l'a proposé le gouvernement provincial. J'avais pas de question, mais c'est simplement un commentaire.
Anybody else? Okay, well, thank you very much, Mr. Dunn, for coming down today. Are there any questions for Dr. Etches? Yes.
Just a quick question, if it's possible to put a little color around the federal government's decision to fund temporarily the consumption treatment centers. Was that, can you just give a little color as to what other municipalities may have benefited from that, and what the mechanism was that permitted that?
I can't speak to internal decision-making of the federal government, but I can say that the chair and the mayor wrote a joint letter to the Minister of Health requesting some assistance, given that we knew this was a service that they have been supporting through the approvals process. Health Canada is the federal government's required to provide the approvals for operation of a consumption treatment service. So the letter went, and we got a response to the letter, an invitation to meet. The chair and I were able to describe the need in terms of what it currently costs per month to operate the service, and the federal government went away and worked on that. We have heard, I have heard through the medical officer of health in Toronto that there are consumption and treatment services in Toronto that are being supported, but I don't have the details on that.
Any other questions or comments? Okay, thank you very much. Can we receive the update? Thank you. Next on the list is item number 3, protecting our community's health, Ottawa Public Health Strategy. And we have a presentation, and we have one delegation signed up already. So if I could ask Cameron to come forward.
While he's coming, I'll just provide a couple of comments. So one is we've mentioned community engagement and hearing from our population as really key to making sure our services are effective. And so I want to recognize that the work on this strategy began a long time ago, and thank Aideen for starting off the conversations in the community, Aideen Reynolds, and to thank Cameron Keys also, who's brought some of his experience in working on strategy with the Children's Hospital of Eastern Ontario to help move it to where it is today. Some people might wonder, why are you doing a strategy for Ottawa Public Health when you don't know if Ottawa Public Health will be in existence after April 2020? I think that's an exaggeration. I'm pretty sure we'll be continuing. And the reason is you can't change a whole system all at once. You can establish a regional board, but someone needs to deliver the services to people. And I think that this plan is really important to focus on the priorities that we've heard about that aren't going to change for the people in the city of Ottawa. So I think we'll let Cameron speak to that a bit more.
Okay, thank you, merci. On behalf of the OPH leadership team, I'm pleased to present our new strategy for your approval. Protecting Our Community's Health, Ottawa Public Health's 2019-2022 strategy is based on the considerable input of employees, community partners, clients, City of Ottawa partners, and current and previous OPH boards of health. Other key sources of input included an in-depth environmental scan and a critical reflection of our organization's strengths, weaknesses, opportunities, and challenges. Maybe one more. With the information and understanding we have at this time, we feel, next slide after that too, thanks. With the information and understanding we have at this time, we feel we have developed a clear and thoughtful strategy that aligns well with the current and emerging health priorities in our community. There is significant need around us, and our strategy is correspondingly ambitious. However, we feel it is also attainable, as we are focused on taking on only a handful of important things to drive at once, on top of continuing to carry out our core functions of health protection and promotion with a focus on prevention of disease and injury. As well as dealing with great need, this is also a time of significant change. So our strategy will need to be robust, and it will be important not to lock ourselves into a fixed long-term plan. With this in mind, we propose to execute the new strategy using annual action plans in order to be more adaptable to change and ensure we can adjust to and be focused on the most relevant and pressing needs. Next slide. The new strategy is made up of different strategic components, from the vision, mission, commitment, strategic direction, goals, measures, and transformational initiatives. Each component of the strategy has its own unique purpose, and when put together, they tell a comprehensive narrative of who we are, what's our purpose, clarity on what we want to improve and achieve, both in the broader, more longer term, and in the more focused shorter term, and finally, how we will track our progress along the way to ensure we are driving good execution and getting where we want to go. I will touch on each of these strategic components at a high level, starting with our core purpose, which includes our new vision, mission, and commitments. Our new vision of why we exist and where we are going is simple and succinct. Ottawa's people, healthy, safe, well. Our mission explains our approach to achieve this vision, and it clearly shows our desire and intent for our collective team to work closely with community partners and clients to carry out our unique mandate and achieve our vision. Next slide. Our principles or commitments are those things we will follow very closely as we carry out our core functions and strategic work. We landed on 4 commitments for the refreshed strategy. Commitment to reconciliation. We will have an update on the important work we are doing towards advancing Indigenous health equity as part of the next agenda item today. Commitment to continuous improvement, whereby all staff truly believe they have 2 jobs, to do their job and improve their job. A commitment to working closely with all our stakeholders to provide responsive and tailored services to support health and health equity in our community. And a commitment to aligning our time and resources to those things that deliver the maximum benefit and value to the community. Strategic directions are the next component of the strategy. Strategic directions are broad pillars or guideposts to keep us on track for the life of the strategy. They are designed to organize the activities we aim to achieve in order to execute on our core purpose. Our new strategy has 4 strategic directions. The first strategic direction relates to the fact that mental health and problematic substance use in Ottawa are serious issues across the lifespan and require proactive and evidence-informed solutions. We need to work with our partners and community to make a greater impact on promoting mental health and reducing the health and social harms of substance use. The second strategic direction is helping to drive health prevention, and a particular focus for this new strategy is helping drive prevention across the healthcare system by playing a key role in mitigating the burden of avoidable health issues and keeping people out of hospital. The third strategic direction relates to influencing the social and physical environments to help ensure communities are planned, built, and supported to positively influence the physical, mental, and social health of all residents. Maximizing the potential in people, processes, and resources to deliver the maximum benefit and value for money is our 4th strategic direction. The next category in the strategy are our goals. Strategic directions are broad outcome-related categories, and they won't change over the life of the strategy. But the goals within the strategic directions are more precise and are assessed annually and are subject to change. Goals provide the focus and clarity on what we need to achieve in order to deliver the longer-term outcomes we are looking for. There is no perfect number of goals to deploy across the organization at once. However, to ensure organizations are not stretched too thin or do not impact their day-to-day core functions, anywhere from 4 to 6 goals per year is generally the recommendation. We selected 5 goals to drive over the next 12 months. The first goal is to drive innovative approaches to mental health and substance use. This goal is about working alongside our partners and key stakeholders, including the Royal, the Community Addiction Peer Support Association, and those with lived and living experience to develop and implement a comprehensive mental health and substance use action plan with a focus on opioids. This comprehensive plan focuses on 3 goals that were identified at the Ottawa Summit in February: preventing stigma, harm reduction initiatives that can reduce harms associated with opioid use, and collaborating and integrating across the system to increase access and uptake of services. Goal 2, Healthy Communities by Design, is based on the notion that our physical environment has the potential to enable people to live healthier lives by making the healthy choice the easier choice. This goal is about working with our partners and community to support the design of vibrant, safe, and inclusive communities to improve the health and well-being of all residents. Our third goal is streamlining through digitization. Digital health innovations have the potential to improve the capacity and quality of health services. This goal is about developing and implementing a new electronic public health record that will help OPH better serve and connect with clients, colleagues, and the broader health system. The required effort to operationalize the EPHR is significant, and it will impact the majority of our staff. It will be one of the largest change initiatives we have undertaken within the organization to date, and we are working very closely with the City of Ottawa's technology team to deliver this. The fourth goal is ensuring a healthy workplace and workforce. When our employees feel psychologically safe and healthy, everyone benefits. A healthy OPH workforce helps foster a healthy community. During times of significant change, as we are in, it is even more important that employees feel engaged, safe, and well. The fifth and final goal is to continuously improve our core work to maximize impact. This goal helps us drive our commitment to a culture of continuous improvement by having our teams continually evaluate and improve the services they deliver to maximize value. Transformational initiatives are another key component of the strategy. Transformational initiatives are those key projects or activities that we need to build now in order to transform the way in which we work later. They are not ready to be deployed as goals and worked on by many teams across the organization, as they are still in the early days of development. We have 3 proposed transformational initiatives. 1 we are initiating, and the other 2 have been mandated by the Ministry of Health and Long-Term Care. The first transformational initiative is community and client engagement, and we are driving this. OPH is committed to understanding and responding to community needs. We have a great social media presence and other online opportunities to regularly engage with clients. We also have excellent client satisfaction rates. This transformational initiative is about taking this even further to embed new and innovative engagement approaches across our geography, teams, and services, to ensure the decisions we make and the work that we do is truly rooted in the voices of clients and partners. Part of the work we are also doing in this initiative is collaborating with the City of Ottawa to create a virtual engagement community where residents can engage with OPH regarding our various programs and services. Vera talked about the first pilot called Engage Ottawa coming out of this initiative. Ontario Healthcare Teams and Public Health Modernization are 2 separate but concurrent initiatives that have been recently initiated by the Ministry of Health, and both will change how we carry out our mandate in the future. In terms of Ontario Healthcare Teams, this is the Ministry of Health's proposed new approach to address hallway medicine and to deliver more integrated, patient-centered care amongst the many care providers. OPH is committed to being part of these healthcare teams and to use our resources and expertise to help care providers better understand the fulsome health needs of the populations they serve, as well as to help drive prevention and keep people out of hospital. Public health modernization arose from the 2019 provincial budget in April and involves shifting the municipal funding formula and regionalizing public health across the province. The aim of this initiative will be to ensure we work closely with all our stakeholders to create the strongest possible public health system that prioritizes access to services across Ottawa's urban, suburban, and rural communities, as well as the larger Eastern Ontario region. Action plan slide. We designed a 3 to 5 year strategy with the notion of delivering and executing on the strategy with focused annual action plans. This slide displays a proposed action plan for the next 12 months. It shows the 3 transformational initiatives and the 5 goals we want to drive, and the associated in-year measures we will use to track and report on our progress. Given the nature of public health work, the impact and benefit of much of what we do can only be effectively measured in the long term. So although we can't measure our true impact on health outcomes in the short term, we feel we can still measure our action plan goals and progress in the shorter term. With this in mind, for goal number 1, drive innovative approaches to mental health and substance use. In the longer term, measures related to stigma, opioid-related deaths, overdose-related emergency visits, access to care, and care coordination will be used to assess our impact. However, for the annual action plan, our proposed short-term measure is the completion rate of the OPH-led action items from the community action plan. This means we will document the key milestones we want to drive over the next year coming from this community action plan, and then track and report out our actual progress to these milestones using this measure. For goal 2, healthy communities by design, longer-term measures related to neighborhood walkability, food access, food affordability, and climate change will be tracked. However, for the annual action plan, our proposed short-term measure is percentage of year 1 healthy community action plan completed. There is a significant amount of work being done to support this goal with the city and across the organization on many different programs and teams, including healthy eating, active living, healthy public policy, injury prevention, chronic disease, and built environment. The measurement of this goal is similar to the previous, whereby we will document the key milestones we want to drive over the next year and track and report our actual progress to these milestones. For goal 3, streamlining through digitization, the measure we propose to use to track the progress of this goal is percentage of OPH program areas online by the set target date. We are still finalizing the EPHR rollout plan with the city and vendor. However, the tentative plan is we are expecting 100% of clinical teams online by April 1st, 2020, and 100% of non-clinical teams online by the summer of 2020 or earlier. For goal 4, healthy workplace and workforce, our proposed measure of success is the annual score on the OPH Guarding Minds at Work survey. This is a validated survey that measures psychological health and safety in the workplace. In 2019, we scored very high relative to other organizations, and our target is to maintain our exceptional results, something that we anticipate may be challenging given the degree of change we'll be experiencing over the next number of years. For goal 5, driving a culture of continuous improvement, our proposed measure is service delivery performance results. The notion behind this measure is most performance problems are in the execution of the processes, not in the people. So we are ensuring all teams report on the performance and quality of the key services they deliver, and this measure compares actual performance results to target. This is a foundational step in furthering our culture of continuous improvement. In closing, this was a quick overview of OPH's new strategy, touching on each component at a high level with particular focus on the improvement work we will be driving over the next 12 months. This strategy represents a focus on continuity of service and the organization's ability to show agility in the face of new demands. We feel this strategy is anchored in evidence and guided by best practice and community engagement and aligns with the unique health needs of our local communities. I will now turn it over to you for any questions or feedback.
Before we go to questions, as indicated, we do have a delegation, so I'm going to ask Hindia Mohammed to come up from the Local Immigration Partnership, and then we'll take questions from board members after that. Welcome.
Thank you, Councillor Egley, councillors, Dr. Etches. Good to be here. We wanted to take some time today to share with you our perspective with regards to immigrants' health, especially at this moment in which there's health restructuring at the provincial level. It was good to be part of your conversation today. And also, especially as you are developing a medium-term strategy going forward. For those of you who do not know the Ottawa Local Immigration Partnership, allow me to take 1 second to talk about who we are. We are a partnership of 60 organizations working in 6 sectors: settlement, economic development, language training, health and well-being, education, and social civic integration. And the 60 partners that are part of the Ottawa Local Immigration Partnership are working on a common vision and shared priorities. And the shared priorities are articulated in what we call the Ottawa Immigration Strategy, which is a long-term strategy for how local organizations would work towards the objectives of building an inclusive and equitable city that takes advantage or leverages the contributions of immigrants. In our health and well-being sector table, we are lucky to bring together key health sector organizations, including the Ottawa Public Health, the Champlain Local Health Integration Network, Health and Resource Centers, and 3 hospitals: CHIO, the Ottawa Hospital, and the Royal Hospital, the Royal Ottawa Hospital. And it also includes social service organizations in health, in settlement and social services. We have 38 members in the health and well-being sector table. The value of that is the fact that we together bring different perspectives as we interrogate the status of immigrants' health and develop strategies for improving the health outcome of immigrants. Just to share with you some information with regards to immigration context in the city of Ottawa. We are the second most important destination of immigrants in Ontario. And in the period of 2019-2022, which is the period covered by the strategy we are discussing today, we expected that Ottawa will welcome 40,000 permanent residents from all over the world, plus more than 100,000 temporary residents, half of which research shows will opt to stay, will become permanent residents. So in total, close to 100,000 new residents will come to Ottawa. And our research also shows that the majority of these over 100,000 new people joining our city in the next 4 or 5 years will come from Africa, Asia, and South America, 75%. Thus, immigration fuels population growth in the city, labor force growth in the city, and also animates the diversity of the Ottawa population. Who is the Ottawa? I liked your slogan when you started the strategy, Cameron. The vision being, what did you say, Ottawa? People, wellness.
Yes.
It spoke to me. And so when we ask who these people are, they are largely immigrants. They are diverse. Many of the people of Ottawa that Ottawa Public Health and the Board of Health is planning for would be diverse. Therefore, adapting our policies, priorities, plans to respond to the needs of Ottawa's growing and diverse population is the focus of OLIP, the Ottawa Local Immigration Partnership, and it's also the focus of the Ottawa Public Health and the Ottawa Board of Health. Having said that, we have some thoughts and some suggestions moving forward beyond this context. I've looked at the functions of Ottawa Public Health, and I'd like to speak to 3 of the functions of the Ottawa Public Health. One of the functions, according to the strategy document, is assessment and surveillance of population health. So we ask ourselves, what is the health status and outcome of immigrants and racialized populations in Ottawa? Is that something the Board of Health knows? We don't know yet. We at OLIP, who have been working for 10 years to work on the directions of immigrants' health strategy on immigrants' health, have not uncovered that yet. However, we know that challenges in accessing jobs, isolation, and experiences of discrimination and multiple barriers in the course of integration means that immigrants' health deteriorates over time. Now, this is meaningful because immigrants' socio-economic status improves with time. However, immigrants' health deteriorates over time due to the stressors of integration. We know, for example, that there's a very high incidence of chronic diseases among subgroups of Ottawa's immigrant population. Chronic diseases such as diabetes and others. We also know that although there isn't a explicit local research, we know from our connections with the community and from reports from the community that there's high incidence of mental health challenges among subgroups of immigrants as well. And so herein lies our first ask of the Ottawa Board of Health as we go forward to develop this strategy for the next few years. We ask that the Ottawa Board of Health undertake a comprehensive research on the health status and health outcomes of immigrants and racialized populations in Ottawa. We also ask that the Ottawa Public Health work with OLIP partners. I've mentioned who is on our table in the health sector table, that the Ottawa Board of Health and Ottawa Public Health work with OLIP partners to develop capacity for collective tracking of progress in improving the health status of immigrants and racialized populations. We have a lot of good ideas and we have academic connections, and so we know the path, but we need the leadership of the Ottawa Board of Health to be on the forefront of this work. Under the function of health promotion and policy development, we know from our work that many ethnic and culturally diverse communities do not share the mainstream understanding of health promotion and disease prevention. It's very much connected with culture. I've asked old ladies in my neighborhood to go for a walk, for example, and they would ask, where am I going? Why would I go for a walk? So it's culturally bound. So culturally and linguistically appropriate health promotion and policy development is necessary. And a key success factor in this area is the incorporation of diverse perspectives at the policy development tables. We often do not know what we do not know. So we're bound to miss important community outcomes or community needs. So a key priority for us to get this right is that at the policy development level, when it comes to health promotion, we have expertise that are also diverse. So our ask of the Ottawa Public Health and Ottawa Board of Health is to hire diverse professionals in higher ranks of OPH, Ottawa Public Health, to ensure access to diverse perspectives in planning and policy development. The good news is that there's a momentum and there's a good effort across all a partnership in multiple sectors. There is a shared focus and priority on immigrant employment in multiple sectors, and we are sharing ideas, resources, and plans. So the Ottawa Public Health would be supported in this area. There's a good momentum in the community. The third function of Ottawa Public Health.
Sorry, I'm going to have to ask you to wrap up. You're into the end of your second 5 minutes.
Okay.
So if you can just sort of wrap up, and then we can move to questions.
Right.
Thank you.
So the final point I would make is in the area of health protection and disease prevention. Again, I spoke about difficulties in accessing jobs, means that immigrants and racialized populations tend to be in the lower ranks of socioeconomic well-being. That means, therefore, that many do not have access to the insurance necessary to access dental health, for example. And we know poor dental health would lead to deterioration of health in general. So the ask in this area, in the area of access to health for immigrants and racialized populations, is to establish free and mobile dental care access for newcomers living in low-income neighborhoods. And I was encouraged earlier when I heard about investments from federal government, I believe it was, in this area. So this may be something that may be included as part of that plan. There's also some challenges with regards to the capacity of healthcare service providers when it comes to people who do not have health insurance. However, we have federal government insurance for people who have, for example, non-permanent residency. So we have interim federal health program. Although the health insurance is there, many health professionals are not making use of that. So we would ask in the area of health protection that the Ottawa Public Health work to create a public education that's targeting healthcare service providers with regards to the use of interim federal health program. The service exists, the investment exists, but many newcomers who don't have status are being declined access to health service for something that already exists. So it's something that is squarely and fully within the capacity of the and mandate of the Ottawa Public Health. So I'll end it there.
Thank you. Are there any questions for the delegation? Member Menard.
Thanks very much, Chair. Thanks very much for your delegation. I'm just wondering, have you met with Ottawa Public Health officials to go through some of this list and associated with this strategic plan and sort of going forward in this year? Have you had a dialogue?
Partly. We were part of the people consulted in the development of this strategy, so we did contribute to that. And we have Ottawa Public Health as part of the OLIP Health and Wellbeing Sector Table. So everything I spoke about is part of the knowledge of that table.
Okay. Just, I raise it because I think the points you're making are very salient for this next year, and I know we had the conversations, and certainly in our office, about the strategic plan involving diverse communities in Ottawa, particularly with affordable housing and the health effects that we know come from, lack of affordable housing, poverty, and folks that need the assistance, new immigrants to Ottawa. So I just think it's very salient what you're speaking about right now, and certainly a need to integrate those aspects into the work we're doing over the next year I also think there's overlap with potentially what changes could be coming to the boards, and the need to ensure that we're responsive to particularly what you mentioned. I guess it's 90,000 new entrants into Ottawa over the next 4 or 5 years. So I think there's a lot of overlap here and just very salient points here you're making. So thanks very much for speaking with us.
Thank you. Any further questions? Okay, seeing none, thank you very much. Are there any questions for staff after the presentation? Member Gower.
Thank you, Mr. Chair. A question for staff is what kind of reports or updates should we expect as a board over the next few years to see how we're tracking against the goals and initiatives that you've presented?
So, yeah, here, I'll go to the actual slide. Can you go to the last slide, actually? Keep going. So you can expect something like this. So something on, we're thinking either quarterly or twice a year, something that has our goals, something that has our measures, and how we're tracking towards that. And so definitely in the form of a report on a regular basis.
Thank you.
Any other questions?
Just
Member Renard.
Thanks very much, Mr. Chair. I'm just wondering if our staff could respond to some of the requests that were made just by the last delegation, how we are trying to integrate some of those aspects. I know we are doing some work in that area, but there's other areas that perhaps we can ramp up in the next little while. And so just hoping for some type of response. I think the delegation had mentioned a working group that they have of 38 folks that come together, and so that also could be of use in this scenario potentially in the next year. So.
Yes, thank you for the question. Thank you, Hindia and Denise, for being here and for informing our strategy as well. So I think what I want to point to that is a commitment that's there in the strategy and that will influence actually every piece of work that we do in all of our programs, including health assessment and health promotion that was mentioned, and how we link people to the healthcare system too. That was the third area, is that of engagement, and that we know that the work of public health is to not just improve the health of the population, but it's to decrease the inequities in health, but within the population. And so that is our commitment there, and it I think it's, I can speak to a couple of specific things, but I think it's also evident and will be very real to immigrants that the transformational work that we're calling community and client engagement is definitely to prioritize the voices of people who aren't always heard, and to make sure that we are bringing those diverse perspectives around the table. Just like you said, we have to do that. There's no question. And I think the other thing is it's a continuous learning for us. That's our culture. That's there in terms of continuously improving our practice. We know that hearing from diverse perspectives will do that. I think sometimes the idea is sort of immigrants, newcomers, that's a subpopulation, a smaller population. It's actually the majority of people in Ottawa are either immigrants or the children of immigrants. So we're not talking about a specialized population. This is the work that we need to do to be relevant. And so when it comes to assessment and surveillance of the health of newcomers and racialized people, there are problems with our data sources. Part of the work we're actually doing right now is to say that you need to ask better questions when you're doing a health survey, the Canadian Community Health Survey, which we use for a lot of our data. We need to be able to cross-reference that with the demographic information. So we're trying to shift how data is collected so we can address these gaps. And then we are also pursuing our own studies where we need to fill in the gaps. So that's happening with regard to mental health in the Black community in Ottawa right now, and we'll continue to do that kind of specialized data collection. Absolutely in partnership. So I think we understand, we're learning in our reconciliation work that the way you collect data, the way you report on data can be problematic. It can contribute to stigma, and so we want to do that, design that, and carry that out in partnership. Around hiring diverse employees, again, sometimes there's a problem with our data. The city does have some information about the workforce, but it's based on voluntarily employees providing that information at the time of hire, and that may not always be safe. So I know the city is doing some thinking about how to collect that information, maybe through, again, a special survey of employees, and that would inform trying to improve the proportion. We do need to improve the diversity of our workforce to reflect our population. We're not there yet, so whatever the numbers are, we know it's not good enough. We need to improve, and the city has set targets, and we follow those targets as well to try to improve, as well as improving the data. So I think all of these points you raised were relevant, and I look forward to continuing to address them. When it comes to health system change and making sure people are accessing the services they can, I think that's where our new work, closer work with the healthcare system, maybe there's a bigger role for public health to highlight, again, the issues of equity and access as one of the things we can contribute. So.
Just finally, Mr. Chair, thank you for that. That's actually very, very helpful. But just finally, on the dental services portion, just with regard to the tour that we went on and the information we received then, some of this I think is just part of the battle is information sharing and making sure that communities receive the information that's out there now. And in that case, on the dental services side, it seems like there's a potential for some sharing there, and hopefully out to different communities that may be able to access the services that are being provided right now. So just thank you very much for responding.
Thank you. Any other questions? Yeah, Member El-Shanturi.
Just a question to, when we talk about the engagement or resident engagement, and we heard that ticks is something Ottawa has a high number of ticks or affected ticks, to say the least, but we are the highest in the province. So I personally started initiating a community meeting in my ward with the public health to educate the community and help to understand the impact. Maybe you should encourage other councillors to have similar engagement session, because we need to talk about the well water and also about the ticks and maybe other public health initiative. But I think this is one of the areas when we talk about engaging the community and understand what a public health does or work. I think we don't want to wait for another flood or tornado to see the valuable our staff do on the ground every day, but we need to have a better engagement or strategy to engage the community. I'm not sure if you agree. We have to spread out a little bit more on this front.
Yes, I think that's why we've highlighted it specifically, is to keep a focus on improving that, and it's transformational. So we don't have a specific target. We're working out the new strategies that will make a difference. And I think you're right, there's multiple different ways. Different communities need to hear from us, and different people have different needs. So we need to try things and evaluate. And so this is something we'll report back on as well.
Thank you. Thank you.
Any other questions? Seeing none. Carrie? Okay, thank you very much. I'm going to ask Member Bannon to bring a motion. We still have one more presentation to go, which the presentation itself, I understand, is at least 12 minutes. And then there's the possibility of questions after. So we need a motion if we're going to go beyond 7 o'clock, and we are going to go beyond 7 o'clock. So if you could bring the motion, Member Bannon.
Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant of subsection 8.1c of the procedural bylaw.
Carried. Okay, thank you very much. And so our next presentation then, as I said, is a video. And it is on the Ottawa Public Health Reconciliation Update. So we'll run that, And then if there's any questions, we have staff in the room that will be able to respond to those.
Someone get the lights, please, or just dim them a bit. Population of Indigenous people in Ottawa is growing. So this video is one way to look at that collective story and to help us understand what are we doing well, where do we need to improve, what are those opportunities as we work towards being a culturally humble and safe organization. So I want to say, Kuyanamik, Chimikwich, Marzi, thank you. Merci to the people who are informing this work, the elders, the partners, the community members, the consultants, and our OPH staff who are working hard to listen, to learn, to understand, and go forward on a good path.
We recognize that reconciliation is an ongoing journey that will ultimately lead to organization and system transformation. This progress is represented by the butterfly. The bees signify the learning opportunities that promote cross-pollination of knowledge, attitudes, and actions across the department.
OPH has been developing an evaluation framework for our reconciliation plan. Our ultimate goal is to become a more culturally safe and humble organization. As part of this evaluation, we've been meeting with Indigenous partners to ask them how we are doing in terms of building respectful relationships and how we can improve. OPH employees have also participated in talking circles to reflect on how we're doing and share what they have learned. We will continue to assess our success through our reconciliation evaluation framework, which is grounded in principles of respect, relationships, reflection, and reciprocity. We will know we have achieved our goal of becoming a culturally safe and humble organization when our Indigenous partners and clients tell us we have.
Throughout my career with OPH, I've had great opportunities for learning, and many of them around Indigenous health and well-being. And probably foremost in mind, most recently, I was able to participate in the Indigenous cultural safety training online. And for me, that was a game changer. I had heard speakers talk about their residential school experiences, and I had interacted with communities, but this was really something that compelled me to learn more, to do more, to be more places. So OPH graciously granted me some leave to go and work in a First Nations community last year. And what I got from that experience was so much more than I gave, and it increased my respect and my desire to do more. But what it really did was make me want to influence the next generation, make sure they know what we can do to be more respectful, to provide better services, and to reduce the health inequities for Indigenous people in our city and in our country.
I feel building relationships is the foundation of reconciliation. And that is what inspires me and guides me. Taking the time to be present, genuinely and wholeheartedly present with partners, clients, and the community is essential. I've learned that each reconciliation journey is unique. Acknowledging our path, as well as respecting that not everyone is in the same place on their journey, is also a critical part of reconciliation. In my mind, numbers and percentages are not the only way to measure and reflect success. Sharing our collective story is invaluable.
The generosity of many
volunteers, and there's just so many good people out there and good partnerships such as this one, and we really, really value that because we can't do it alone.
I have had the privilege of working with our local Indigenous agencies and community members on several projects. I have many memories, but one really sticks out for me and highlights the principle of reciprocity. It took place when I had the honor to co-facilitate parenting circles. I was always welcomed as part of the group. Each circle would start with a smudging ceremony and a welcome song. I always chose to play the drum, and with a bit of coaching, managed to learn the songs. I recall being nervous about making a mistake with the smudging ceremony, but was reminded that as long as my heart was pure, I would be okay. And that meant a lot to me. I still miss those days. We cooked together and shared knowledge about parenting practices, a variety of health promotion topics, and so much more. We all learned from each other.
As part of our evaluation, we participated in several meetings with Indigenous partners. We heard that OPH contributions, collaborations, and advocacy are valued, that we are a credible and reliable source of information, and that we have an important role to influence and inform the health and social system about Indigenous health equity. OPH is promoting awareness about the Truth and Reconciliation Commission calls to action and the United Nations Declaration on the Rights of Indigenous Peoples when considering changes to the built environment as part of creating healthier communities initiatives. It was a pleasure to work in collaboration with OPH to provide an opportunity for staff to learn more about Inuit culture and language. This event was an example of what can be accomplished when there is a commitment to reconciliation, a relationship with the urban Indigenous community, and a willingness to think outside the box. I have experienced intense racism at a dental office in Vancouver. Having a place like Wabano in Ottawa means that I can relax, not feel attacked for my insurance, and not having to defend myself for being Native before I even see the dentist. Dental work is not inherently pleasant. It is a blessing to have a peaceful visit, not one that triggers my anxiety. Thank you to Wabano, your funders, and to the wonderful staff there.
It's really important that we do work in hand to be able to say, okay, you know what, here's a good guy coming in, he really cares, you know, and I think that partnership is really crucial in making, in serving our families, especially the high risk families.
This advocacy, funding, and support of the Share Your Story project has been the most significant milestone in the relationship between Ottawa Public Health and urban Indigenous community. This speaks volumes to intention and, most importantly, action towards reconciliation.
I am a settler who lives and works on the traditional, unceded land of the Algonquin Anishinaabe people. As an important first step in reconciliation, the Indigenous Cultural Safety course allows you to reflect on your own identity. This has meant learning that my white, European, English-speaking grandparents had easy entry to Canada because of a racist Immigration Act. This privilege is something I carry every day, and I need to be accountable to it and work to dismantle it. As a public health nurse, it is critical to understand both the historical trauma and the continued impacts of colonization on Indigenous lives and health. The course promotes a better understanding of when to stand up for, beside, and behind people. Settler colonialism is ongoing, and we all have a responsibility to work to foster space and relationships where Indigenous knowledge is valued and voices are heard. With Ottawa Public Health's commitment to the Reconciliation Plan, I am left feeling hope-filled.
We heard that there are many opportunities for further action, collaboration, and shared advocacy on a number of issues that can influence policy and practice. For example, we can develop a comprehensive, progressive, long-term plan for Indigenous cultural safety training. We can make it a requirement for new employee orientation and all frontline service providers. We can make sure that employees are aware of culture-based programs in the community and that anti-Indigenous racism training is an essential part of this plan. We can work together to promote healthy growth and development, mental health, sexual health, violence prevention, and food security in a holistic way with tailored approaches. We We can support harm reduction strategies. We can offer work, shadow, employment, and shared learning opportunities. And we can ensure that everyone is aware of practices that promote a culture of safety, empowerment, and healing. In other words, we can provide trauma-informed care.
What we recognize we need to understand from the community's perspective is what success looks like. That we have an idea we need to work on reconciliation, but what does that mean for the community? When would the community feel that we have made progress?
Well, for me, I think it goes back to the notion of how do we measure success? But even before we get to the point of measuring success, it's defining success and defining it from an Indigenous perspective, using what we know and how we interact, and finding definitions that are culturally based and respectful, but also realizing that we live in a contemporary world where numbers and data is important, but we need to be able to take that information to build where we want to go. So when we talk about, 5, 10, 20 years out, how we interact and what we measure and what we define as measures of success, whether it's creating more housing, whether it's reducing dependence on the healthcare system, whether it's achieving better educational attainment, they all matter, and they all matter in terms of how we're building community, how we interact, and where we started this conversation out in the beginning was working together. We have to keep doing that.
So we get the lights, please.
Thanks very much. I know we have staff in the room or Dr. Etches that can answer any questions board members might have. And if not, then we accept the report for information. So receive then? Oh.
How has the feedback from the Indigenous community been with respect to the action plan that was established in June 2018, and how have we reached out to get their thoughts 1 year down the road?
So I can start to answer that, and if I think it's Kim here, Aideen's here, Sarah, if you want to add more. So we've built the Reconciliation Action Plan with input from the community, and then when we wanted to establish the evaluation framework, we went back, and so we met, for instance, with Indigenous led organizations like Wabano, with Minwashin Lodge, with the Inuit Children's Center, and we're capturing some of that footage actually in the video and some of the feedback. So that what we heard was it's important to, in measuring those actions, also tell the stories about what's happening, and so hearing about the work that makes a difference. I think the video captures some ideas for ongoing work that people raise, like the things that they say we can continue working on. But if I had to summarize it, I would say the feedback is that we're on the right track. The feedback is that they appreciate the relationships, that we should continue to work together. So the Ottawa Aboriginal Coalition is led by Mark Miracle, who was speaking more towards the end, and that was his comments. So I think, in summary, people appreciate the work that Ottawa Public Health is doing under the Reconciliation Action Plan, and they see ways to continue it into the future. If that answers your question, or if anyone wants to say anything else. It's good.
Okay, Member Banham.
In the previous presentation by OLIP, they talked about hiring diverse workforce. And I think that having Indigenous perspectives is also important. And I'm wondering if there's any data or any future push to hire more Indigenous workers at Ottawa Public Health, and perhaps a goal one day for either Indigenous perspectives to be at the Board of Health level.
Yes, absolutely. Similar to looking at the proportion of our workforce which is self-identified as an immigrant or newcomer, the question is asked about whether people are from First Nations, Métis, or Inuit background. Same problems with the data, but the same objectives to increase that proportion. So we do track that, and we're looking at that. Actually, one of the actions that has come forward is to look at in our hiring practices to focus on whether there's more we can do around bringing people with a First Nations or Métis background to work with Ottawa Public Health.
Thank you. Seeing no more questions, can we receive the report? Okay, thank you. Member Banham, motion to adopt reports.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Protecting Our Community Health, Ottawa Public Health 2019 to 2022 Strategy, Ottawa Public Health Reconciliation Plan Update, Ottawa Public Health Submission to Health Canada on Reducing Youth Access and Appeal of Vaping Products, Potential Regulatory Measures, Review and Update of Board of Health Policies and Bylaws, 2019 Operating Budget Q1, Board of Health for the City of Ottawa Health Unit Status Report, and Performance Appraisal of Medical Officer of Health in camera, personal matters about an identifiable individual, reporting out date, not to be reported out, be received and adopted.
Carried. Okay. Are there any motions requiring suspension of the rules of procedure? Okay, thank you. Any notices of motion for consideration at a subsequent meeting? Okay, thank you. Member Banham, the confirmation bylaw.
Be it resolved that confirmation bylaw number 2019-4, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of June 17th, 2019, be read and passed.
Carried. Okay. Inquiries, I have an inquiry, so I'll go first, and if anybody else has any inquiries. This inquiry comes out of a meeting that I held with Nature Canada, which Erin Sawuski from Public Health was, and I think Erin's in the room, it's kind of hard to see, yeah, there she is. The lights aren't back on yet, was good enough to attend as well. And so the inquiry is on the subject of reducing screen time and promoting nature and outdoor play. And the inquiry is as follows. Reducing screen time and increasing unstructured play and time spent outdoors have been shown through research to benefit children's physical, psychological, and cognitive health, their behavioral conduct and academic achievement. What, if anything, has OPH been doing to promote nature and outdoor play and to reduce children's screen time? How does OPH support parents in increasing the time their children spend in nature? Are there any other inquiries? Okay, seeing none, I'm going to adjourn. Our next meeting is September the 16th, 2019. Now, having said that, happy summer, obviously, but these are challenging and exciting times for public health with the current processes and proposals underway. So make no guarantees. We may not have to have some sort of an emergency meeting between now and September around the consultations, for example, something along those lines. But the plan going forward in any event is we'll see everybody back in September. And again, as I say, everybody have a safe and happy summer. Are we adjourned? Thank you.